Hello, everyone. You're welcome to another session of A Day with your fertility specialist. My name is Precious Adama, and I'm going to be your anchor for today. Thank you so much for tuning in. Thank you for your likes. Don't forget to subscribe and forward this to as many people as you can so they too can be part of the knowledge sharing session. So, today we'll be talking about laparoscopy in fertility care and what it aims to uncover and treat. With us today to shed more light, we have with us Dr. Jean. Welcome, Mark. Good afternoon.
Good afternoon, Precious. Thank you for having me.
You're welcome. It's a pleasure to have you as always. So, for the purpose of someone joining us for the very first time, Dr. Jane, she's a fertility expert, a gynecologist, and a minimal access surgeon. So, she's going to be answering all our questions. Feel free to bombard her with as many as you can. So, over to you, Dr. Jane. So we're talking about laparoscopy today. I'm sure when many people hear about it, they'll think it's this major surgery that is very invasive. So can you simply tell us what it means, what it entails in fertility care?
Well, laparoscopy is I would say it's a minimally invasive surgery. So it's when we say minimal, so we talk about when you say something is minimal, just a small invasion of the abdominal cavity. So your doctor or your gynecologist looks into your belly with a microscope with a very tiny cut, about 1 centimeter long, to have access, which will now be projected on cameras, and that helps you to pick problems within the belly, like the around with the reproductive system. We're talking about the uterus, the ovaries. Look out for conditions that could affect fertility in one way or the other. So it's not compared to the big surgeries, and that is when we say minimal, it means that you can leave the hospital on the same day,
Oh, wow.
depending on what was done. So you come in, you go, and that is how it is. So it's something very simple, straightforward, and usually produces a lot of results that help with
Okay.
subsequent management of conditions. Yeah.
Okay. Oh, that's good. So how is it different from your conventional abdominal scan? The laparoscopy?
Okay. So a laparoscopy, as I said, is a minimal invasive surgery. So I said, when the doctor makes small cuts on your belly and uses a camera to look into your belly,
Okay.
to see pick abnormalities. But conventional surgeries has to do with very large cuts and
Okay.
belly, yes. So you open the tummy, you can see with your eyes. In laparoscopy, you are seeing, viewing with the aid of cameras. Now you are
Yes.
seeing with your eyes. You can handle the structures with your hands,
Okay.
the uterus, the ovaries. But with laparoscopy, you use other supportive instruments. Once the
Okay.
camera goes in, you have other instruments that helps you pick, elevate, cut, treat, do whatever you have to do in the belly.
Oh,
So
wow.
that's why you have a very under. You won't feel any pain, so you can go
Okay.
home.
You won't feel any pain.
You won't feel pain. You'll be
Wow.
fully under anesthesia,
Okay.
and so it's something that takes. It doesn't cut so much, less pain. Recovery is faster, and scar tissue formation too is reduced significantly compared to the open surgeries that has to do with very large cuts up to 10 centimeters
Okay.
long. Gives you
Yes.
big scars,
Yes.
more pain, longer hospital stay, longer recovery
Recovery
time,
time.
and all of that.
Okay. Okay. Sounds fair. So many patients have normal scans but struggle to conceive. What kind of hidden conditions can laparoscopy reveal that normal imaging may miss?
Also, normal imaging can miss scar tissues, so you
Okay.
can have scar tissues around the tubes, the ovaries, and all of those can prevent free movement of the reproductive structures. So conception becomes a challenge.
Okay.
Yes. Conventional scans too can miss early endometriosis. Endometriotic tissues, you can also sometimes some persons would miss some ovarian endometriosis. All of those things increase chances for scar tissue formation, difficulty with conception, and all of that. Then there can be some abnormalities on the uterus when we have uterus dividing, what we call septate uterus, and
Okay.
all of that, biconate uterus. The laparoscopy can help pick up some of those abnormalities that can make
Wow.
conception difficult too. Yes.
Wow. So it's safe to say that laparoscopy can be a gold standard.
Yes, it's a gold standard to make a diagnosis of endometriosis,
Okay.
but all these other yes, laparoscopy can help you see. At this point, laparoscopy you see and sometimes treat. That is it.
Okay.
So you on one spot, so you can see and treat at the same time.
Wow.
Again, laparoscopy can also pick fluids in your tubes. So when there is water in your tube, what we call hydrosalpinx, that can also be toxic to the embryos, and that can be
Okay.
treated on table. So those are some things that might be missed depending on the expertise of the person doing the scan at the time, that
Okay.
can be easily picked, because this time you are seeing real-time pictures of the cavity. Yes.
Okay. So at what point should people consider laparoscopy? Is it a first line investigation or something reserved for selected cases?
Yes, it's not a first line investigation.
Okay.
Your first fertility evaluation should be blood, the
Yes,
conventional ultrasound
scan.
scan, and all of that to pick. So when you now do your regular investigations. By the time this cannot pick any abnormality, you
Yes.
can now, because you also there's a place for hysterosalpingography, which is complementary with laparoscopy. That
Okay.
also assesses tubal patency. Laparoscopy too can do that, but you can do all of those before getting to this point. So when you are not able to pick any condition from those evaluations, you
Okay.
can now come to laparoscopy, but they can complement themselves. So
Okay.
you can do HSG for tubal blockage. Then sometimes, if the results are not very clear, a laparoscopy can complement that and gives you a result. So it's not first line. It's
Okay.
always after you'd have done your basic investigations. Yes.
All right. Okay, let's talk about endometriosis, which you've mentioned earlier. It's been said that it's difficult to diagnose without laparoscopy, which is true.
Yes, laparoscopy is said to be the gold standard.
Yes.
But if diagnosis of a condition is made from the history, your examination, your investigations. Laparoscopy is one of your investigations. So you
Okay.
don't just run a woman, every client, you just run to laparoscopy. You take your history, examine, and all of that. By the time you get to laparoscopy, you would have had a high index of suspicion of
Okay.
endometriosis. So when you are so it's not laparoscopy is the gold standard to make it diagnosis, because at laparoscopy you see the endometriotic lesions, as we call them,
Okay.
on the structures, because they can be scattered on all the surfaces of the structures, the uterus, the ovaries, the connecting structures, and all of that. So you see them real time, and you can
Okay.
also burn them or take them out at that point.
All right. So let's talk about removing pelvic adhesions. Does it increase the woman's chances of conception?
Well,
With
a yes and no. So when you take off adhesions, yes, it can improve her chances, but it's not a go to, like you can, it's not 100% all the time. So taking out adhesions doesn't mean natural conception automatically would happen, but that improves her chances significantly. And that is one of the reasons for laparoscopy. You
okay.
see pelvic adhesions, you treat them on table, and gives the woman a lot of relief before she leaves your theatre operating room.
So if a woman's fallopian tubes are blocked, can laparoscopy fix them, or is IVF the better option?
Laparoscopy will not fix a blocked fallopian tube, but it helps confirm that your tubes are blocked. IVF is the best option for conception for women with blocked tubes.
Okay.
because now the tubes is the patent tubes that is the pathway for
Yes.
the embryo to get to the uterus. So
Okay.
once the conceptus cannot get to the uterus, then fertility is almost impossible. Yes. Any other thing could be an ectopic, an abnormal pregnancy.
Oh, all right. All right. So, how do you decide whether surgery or IVF is going to be the best chance at having success? Whether this laparoscopy or IVF is the better option?
For a client, well,
Yes.
in treatment of patients, generally you individualize them. So a woman's symptoms, complaints will direct you on your best option of what you would offer her. So a woman comes in with painful periods, pain during intercourse, challenges with conception. You want to do your conventional history like you have gotten, examine her laparoscopy to make a diagnosis. With a diagnosis, you can guide subsequent treatments. So another woman comes, okay, she has done HSG, tubes are blocks,
Yes.
she's done other investigations and can confirm, and so she spent 8 years trying to conceive. At this point in time, laparoscopy would not give you much. You would rather want to do a hysteroscopy, confirm that the lining of her womb is ready to take babies, do other investigations, your scans, and IVF will be her next pathway, as
Okay.
laparoscopy would not improve the tubal blockage. Well, for
Okay.
some reason, some would say if it's just mucus plug within the
Yes.
tubes, if you push in your dye to confirm tubal patency, that's the opening of the tubes, it can give way. But that's not 100%. Most times when we talk of adhesions, we are talking of real adhesions that would have happened over the time or blocked tubes. So you can choose what to offer a woman at the time of when you converse with them. So
Okay.
what you offer patient A will
It's
not be patient
different
B.
from
So
what you
patient A
offer.
might be going for laparoscopy, while patient B will be going for
Hysteroscopy.
hysteroscopy. If someone that has polycystic ovaries, irregular menstruation, and all of that, laparoscopy can help. You can offer what we call laparoscopic ovarian drill. It improves frequency of ovulation, chances of spontaneous pregnancy too. So
Wow.
just differs according to the patient's complaints.
Okay. Laparoscopy actually does a lot. It's
Yes.
what everything you said. So, are there situations where laparoscopy might actually delay treatment unnecessarily? Are there any situations like that?
No, there are no situations like that. So
Okay.
you just it depends on what you want to do again. So if it's laparoscopy, she goes ahead, gets her laparoscopy done. If it's IVF, she goes ahead to give her the treatment she deserves. Yes.
Okay.
Because if except you want to go laparoscopy, you want to take out, do now what we call therapeutic treatment. You want to take out endometriotic cysts, like what is in the
Okay.
ovaries,
Yes.
collection of those endometriotic deposits over time. Yes, because that can be done surgically. It means that
Okay.
when you
Wow.
do that, you give her some time to heal before you start your IVF and treatment. That's when delays, of course, because one treatment comes before the other, but not
Okay.
because you want to wait. Laparoscopy must come before this treatment. No, it doesn't go that way.
Oh. Okay. So, is it recommended for every woman struggling with infertility? If not, who benefits the most from this?
No, it's not recommended for every woman struggling with fertility.
Mhm.
Yeah, so like we said again, you individualize your patients. Those that need laparoscopy get laparoscopy. Those that don't need laparoscopy go ahead with the next step of set of treatments that will be offered them.
Okay.
So talked about those suspicion of endometriosis, those with polycystic ovaries, those you suspect to have pelvic adhesions, and all of that. So it keeps going on and on.
So, with all this, are there risks that the patient should know about before agreeing to the procedure? Is there any
Yes,
risk?
yes, it's a standard thing to counsel a client or a patient for a procedure. There are always complications or risk to every surgery, but with expertise, a lot of these complications are things that can be controlled or prevented. But
Okay.
it's standard practice for every patient to be aware of complications that could arise from any surgery that they are about to embark on, as minimally invasive as it is. there can be complication that would warrant longer hospital stay. So the
Okay.
patient needs to know. So when it happens, it's not because you didn't do it right, but because it's a possibility that that could happen. But a lot of
Okay.
times you try to prevent most of these with
Yes.
also knowledge and increase in understanding of processes that happens in the hospital.
Okay. So what are some of the risks you've seen, if any, at all?
Well,
Like,
okay. So the risk, when a patient is going for surgery, they are going to
yes.
get anesthesia, general
Yes.
anesthesia. So that's what we call anesthetic risk. Then when you are doing the laparoscopy, you can
Itself,
have
yes.
injuries to structures. There can be bleeding. The laparoscopy can be converted to an open surgery. What you're avoiding initially and all of
Yes.
that. So all those complications could arise. Even the
Mm-hmm.
tiny hole you make can even get infected.
Oh,
So, but all of those things can be prevented again. So, yes, they can happen in the surgery.
okay. So I'm sure that many think that this procedure guarantees pregnancy automatically. Is that a realistic expectation?
No, it's not a realistic expectation, but it can improve chances when you take
Okay.
out some of those mild adhesions and also drill the ovaries. Yes, so it can improve your
The
chances
chances.
significantly,
Okay.
but it
That's good
doesn't.
to know.
Yes.
That's good to know. So after laparoscopy, how soon can someone start trying to conceive?
Well, you can start trying. Well, laparoscopy depends on what you did it for. If you did
Okay.
it for diagnostic, because you can do it to just see the problem,
Yes.
then you can also do laparoscopy to treat a problem. Yeah, so if you do it to see a problem, then once you're able to solve the problem, the patient can start to try immediately.
Okay. Wow.
Yes.
That's good to know. So does age influence laparoscopy in
No,
any
age,
way?
no, age doesn't. It's a procedure that can be done for everyone. But now, where you select your patients, when an older client comes in, you want to also check for medical conditions that could be contraindicated for
Okay.
them to have laparoscopy.
Oh wow. So when a couple first visits the fertility clinic, what are some of the key things you assess before commencing the treatment at
Again,
large?
yeah, so it's to take their history basically to find out which direction your treatment would go. So it's individualized. So we can't talk of everything you discuss in the clinic.
Okay.
But if the client's complaints is in this direction, you take her through that pathway, determine if she needs laparoscopy, she needs a scan, she needs hysteroscopy, and eventually what treatment you're offering her, what form of treatment, because not everybody's going to get the same form of treatment,
Yes,
not everybody's
definitely.
going to get the same form of, but the basic evaluation will be the same across board, especially when fertility challenge is what is the major complaint. But other investigations, some special investigations, not everybody will go for laparoscopy, not everybody would have then hysteroscopy too. There are some that must have, while some others, yes, some from some history and all your scans, you can tell who needs, who doesn't need. But you select your patient. So treatment is individualized when the patient
Okay.
comes into the clinic.
Oh, wow. Thank you. So can laparoscopy treat some of these conditions at the same time they are diagnosed?
Yes, that's why I said you see the problem and treat on table. That's the advantage. One of the
Okay.
advantages of laparoscopy.
All right. Okay. So we have a question from Patience George from YouTube. She asked, please, can a laparoscopy detect cyst in the ovaries
Yes, laparoscopy can detect cyst in the ovaries, and cyst in the ovaries can be taken out at laparoscopy.
at the same time?
Yes.
Okay. All right. Patience, I hope your question has been answered. And she also asked, since it's minimal, can you have a laparoscopy often, like more than once?
It's not as the fact that it's minimal doesn't mean you should have it without a valid indication.
Okay.
So when we say indication, these are reasons why a woman should have laparoscopy. So she comes in, you do laparoscopy, treat the problem or identify a problem and plan to treat.
Okay.
Then, if a woman has another need for a laparoscopy, why not? She should have that, but it shouldn't be something that you would schedule um, at intervals because it's a minimal access procedure. So there has to be a reason for you to go into the abdominal cavity. Remember, the complications are there,
Yes,
and
you
you don't want
mentioned
to
that.
expose a woman unnecessarily to those complications. Yes.
Okay. Thank you. You answered the questions perfectly. So I think last on our list, how long does this procedure take? Like on a normal basis, everything going fine. How
Uh,
long should it take?
Come and take 45 minutes.
45 minutes.
Yes,
Okay.
about 45 minutes or there. So
Thereabouts.
now depends if you are doing a diagnostic. Now, when we say diagnostic, you want to just see the problem.
Yes.
Yes, it can be shorter. You go in, you see the problem, so you come out. If you are doing an operative, now we're talking about or therapeutic, where you are treating a problem, it can be a little longer. Say you are taking out the cyst, you are tying the tubes because there's water in the tube in preparation for fertility treatment. So what you're doing determines how long you spend. On average, 45 minutes, 1 hour, you should be
Fine.
done with the whole procedure.
Okay. All right. Thank you so much, Dr. Jane. Thank you to all our viewers for sticking around. I hope we all have a more proper knowledge about laparoscopy in fertility care, what it entails. And I just want to say this is not just for knowledge sharing purposes. We actually carry out all these procedures here at Alps Hospital. So if any of this piques your interest, feel free to visit us. We are just one call away. You can reach out, you can walk into our facilities here in Plateau State and in Abuja, wherever it is you want to. And always remember the journey to parenthood is not always straightforward, but with the right diagnosis, it can definitely make a difference. Thank you so much for sticking around to the very end. Don't forget to catch us at our next sessions. We do this every Wednesdays and Fridays, 3 p.m. remains the time. Thank you so much. Do have a blessed weekend ahead. Bye.